And good morning, ladies and gentlemen. Welcome back to the IoT Asia Plus Connect series, web engagement series. I'm Edric. I'm very, very happy to be hosting. This is our fourth episode, and it so happens it's also the Chinese New Year episode. So happy New Year, happy Lunar New Year to all of you who are joining us today. And now, the IoT Asia Connect series, right, is really a series that provides you the opportunity to connect, converge, and collaborate with industry practitioners, thought leaders, and the IoT community at large to drive innovative solutions for real-world business transformation. Our fourth episode is jointly organized by SingX and SIAA in collaboration with Allied Telesis and Kent Ridge Healthcare. I would like to go through a few housekeeping slides before I introduce you to our distinguished speaker and panelists today. If you have any questions for the speakers and panelists, please type it into the Q&A function, which should be somewhere there on your screen, right? We'll also be taking questions from the floor at the end of the session. If you are facing any technical issues whatsoever, raise your hand or type it into the chat function and we will attend to you very, very shortly. Now, ladies and gentlemen, as you know, the IoT Asia Plus web engagement series is all about engagement. So in that sense, I need to make sure that it's working for you. Okay, so for those who have enjoyed the Chinese New Year holidays, could you help me to do something? Just rate it in out of five being the best, one being the worst experience for this year compared to other Chinese New Year sessions. Let's try that, shall we? Would you be able to open up your chat function and type in whether or not it was a 3 out of 5 maybe because you didn't get to visit so much, or 5 out of 5 because you got all the rest you needed? Let's try that. Oh, wow. Okay, 1 out of 5, Daphne. Wow. Okay, we're having a great morning this morning. So Daphne, why 1 out of 5? So just a quick question. Why 1 out of 5? Okay, Bernard, 3 out of 5. Meh. Okay, seems like everybody's having kind of a mediocre one. Oh, Cecilia went 5 out of 5. Staying home all day isn't fun. Well, Daphne, staying home all day isn't fun, definitely, but at least we're allowed to go out, right? Depending on which part of the world you're in, at least or at least in Singapore over here, we're quite lucky to say that we're still pretty much up and about. Other parts of the world, unfortunately, is not that great. On the whole over here, wow, average is pretty good. Is pretty good. Not too bad at all. Just a personal story. I pretty much enjoyed my Chinese New Year. Reason why is because it wasn't so much hustle and bustle for me this year, and at the same time, right, helped me save a little bit of money. I didn't need to go out and give out too much hongbao this year, so that helped a little bit. And on my end, I am pretty happy about that. So, ladies and gentlemen, thank you so much for putting in your comments. I really appreciate that. So, from time to time, we will be interacting this way. So, do have your fingers all warmed up. Make sure you have your coffee or your tea next to you because it's going to be a great session. Okay. And before we move forward, we're going to be running a short poll to obtain your feedback on certain issues. So your response to these questions will be very helpful in planning for our upcoming sessions. The poll should be appearing on your screen very, very shortly. Maybe right now. There you go. The poll is up. We've got 3 questions for you. Which of the following do you think represents the percentage of health facilities that have adopted IoT or IoMT across Asia? Second question is, which of the following do you think is the biggest challenge in adopting IoHT or IoMT? And last question for this poll is, which technology do you think will see the most growth in healthcare within the next 1 to 2 years? All right, let's take 20 to 30 seconds to fill in this poll. Just give those things a click and we will then show the polls in a little bit. But in the meantime, for those who have already done it, can somebody, for the love of God, please tell me and teach this ignorant one over here, what exactly is the difference between IOMT and IOHT? If you could type it into the chat, I would completely be indebted to you for a while as well. So do me a favor and educate me. What's the difference between IOMT and IOHT? If anybody could help me out here, that would be great. Well, Ooh, thank you, Pak. And IOHT, what would it be the difference be? Oh, I see, I see, I see. Okay, now thank you so much, Pak. Really appreciate that. And I believe that the polls should be in right now. Let's take a look at the polls. All right, thank you so much. Um, let's see now. Wow, this is very interesting. Health facilities have not adopted, less than 15%. You think have not adopted, and less than 50% in general have not adopted IOMT and IOST. That's a huge amount and great business opportunity, I think, over there for us to explore. Which is the biggest, question number two following, do you think is the biggest challenge in adopting IOMT or IOHT? Privacy and data security. Wonderful. I think we're all on the same track, and we're always thinking that potentially, right, this is where the probably where we need to move forward, especially with the amount of data that's going to be flying through in both 4G and 5G once that comes in. And lastly, telehealth and remote monitoring will be the highest growth. That's wonderful. I think that's great news, especially for quite a number of our panelists as well, and speakers and panelists. Okay, with that, thank you so much for your responses. I have a couple of a short announcement to also make to all of you. Could I have my slides, please? Now, this will just take a couple of minutes. I just wanted to share a little bit more about the developments of IoT Asia. Now, as you know, this is our fourth episode so far. And you're probably wondering, are we not doing an event? What's IoT doing? What's IoT Asia all about? So we are moving forward, in this day and age, that we're not going to do IoT Asia as a single event in a year. As a matter of fact, we're going to be having a combination of both small physical get-togethers, as well as digital conferences. All this is going to be held right within the IoT Asia Plus digital platform. We are launching this 19th to 20th of May with a conference, right? A digital conference with physical meetups as well. So we have four key offerings within this particular platform. And that's, of course, all this content, webinars, brochures, news, and other content articles that we do in-house are going to be housed in our IoT Asia platform. At the same time, we'll also be organizing digital conferences with quarterly satellite events or meetups for the IoT community to come down, view product showcases, product demos, and also, of course, to network with the IoT community. And lastly, if you are very, very keen on putting collaborations together, working with IHLs, or just working with other like-minded professionals to deal with industry's challenges, we will have all of that on the Spring Projects initiative that we have on our platform as well. Next slide, please. So all in all, this is going to be held within our IoT Asia Plus digital platform, and it's going to be launched again 19th to 20th of May. Mark your calendars. It's going to be a 2-day digital conference with some physical meetups, and at the same time, 4 main tracks covering healthcare, real estate, transport and logistics, and retail, all about IoT and how that implements into this entire ecosystem. We are aiming for 4,000 registered users, and that includes all of you as well. So later on, if you'd be so keen to be one of the first adopters, to join us and give us your feedback as the initial testers for this platform, feel free to just give us a hands up as well, or you can type into the chat interested. Right. At the same time, later at the end, we will also provide you with a QR code to scan to join our mailing list if you'd be keen to be one of our testers and the initial adopters for the IoT Asia Plus platform. So there'll be 4 main tracks. Next slide, please. There'll be 4 main tracks that we'll be covering. And again, these are just some of the topics. If, for example, you would like to be one of the, let's say, for example, you would like to speak on a certain topic and you think you have a lot to offer to the IoT community and you want to address certain industry challenges that you think that nobody talks about, feel free to write in to me. All right, my contact details will be inside the next slide as well. Next slide, please. So there are four main tracks here: real estate, transport and logistics, healthcare, and retail. If you are going to be keen on speaking or sharing a little bit more on these solutions within IoT and how this affects the ecosystem, feel free to write in to me. And if you want to fully utilize the platform for even lead generation and sales opportunities, feel free. My contact details are on screen right now. Feel free to just take that down and let me know. Okay. And thank you so much for your time. I'm very, very happy to now move on to our keynote speaker for the day. I'd like to introduce our keynote speaker, Dr. Adam Chee, Chief, Smart Health Leadership Center, Institute of Systems Science, and US. Dr. Chee has more than 20 years of health informatics, digital health, innovation, technologies, and business experience. Prior to joining ISS, he was the director of BNHC Private Limited, spearheading many significant and notable projects across Asia Pacific and Middle East. He is responsible for providing digital health transformation expertise to both healthcare and solutions providers via consulting assignments, executive coaching, training, leadership, and speaking engagements. Without further ado, welcome Dr. Chee to the fourth episode of the IoT Asia Plus web engagement series. Over to you, please, Dr. Chee.
Hello, thanks for your introduction. I'm just going to go straight and present the slides. Okay, common question. You guys can see my slides, okay, right? I take that as a yes.
Yes, Dr.
So I'm
Chee, we
just
can
going to
hear
go
you.
ahead.
Yes.
So
Yes.
yeah, so I'm just going to go ahead. So yeah, the topic I'm going to be sharing with you guys in the next 20 minutes is titled Transforming Telehealth with AI. And before I continue, just a quick introduction of myself. My name is Adam, as introduced by Eric. I'm currently with the Smart Health Leadership Center over at NUS, and I do serve on different associations and organizations. So just to give you a brief overview, more importantly, there is no conflict of interest. I'm not selling you anything today. So with that, so the common thing when we talk about telehealth, when the conversation comes up, when I talk to industrial practitioners, healthcare professionals, etc., many times um, recipients of telehealth who are not familiar with the technology or the concept itself will have a very futuristic ideals. You know, you'll be maybe looking at science, sci-fi kind of visualization diagrams, able to do anatomy, diagnosis through certain gadgets, etc., or even robotic surgery that is controlling via fancy interface, etc. Now, of course, a lot of these times, such inspirations were derived, as I mentioned earlier on, from sci-fi movies, TV series, etc. And they are advancement of technologies in some of these areas. But the reality is, a lot of times what we see in the field, what we call what people envision, and there's nothing wrong. However, it is really more hype than reality. So fact of the matter is a lot of people hyped up on what is currently available today. This is partially also due to solution providers sometimes trying to visualize and advocate on what is possible. You try to make it sexy. Uh, so what we do today for this particular session is we'll go back to the ground level and look at what is possible. Of course, we also look at what is available at the moment, and then we go on from there. So to begin, there are some very traditional thoughts on telehealth, what telehealth actually constitutes of. And even today, when you go onto the internet, you search for it, look at textbook, you go on some of the courses that's being conducted today. When they talk of telehealth, they still go by this very old school classification of telehealth. They tell, oh, there's two versions, there's the real time and the story forward version. Fundamentally, synchronous and asynchronous aspects of telehealth. Now, it is important to understand that the reason for such classification is based on two very important elements. The assumption that there is a need to send acquired data to another location. And the reason why usually you need to send the data to another location is because you need a healthcare professional to actually process that data. So the above concepts is actually what we called so last year. That's like 1990s. Such design models are really based on limitations from a previous era. It's no longer applicable actually. But unfortunately, a lot of solution providers, so-called thought leaders, they still advocate on this. It's all, there's two types, synchronous, asynchronous, and they're based on solutions on that. Now that, don't get me wrong, there are situations where you need to implement it that way. And that would be situations where you don't have the necessary requirements, like a very rural area where you don't have the capacity, the technology. But the technology is that you just don't have the money to invest it, you don't have the infrastructure. But in reality, when we talk about telehealth today, we use it in modern cities as well. So it's very important to understand that this mindset is really, really outdated. And handing on to such best practices is actually very dangerous. This is extremely important. So some of the more common usage of telehealth, we will have, remote patient monitoring. Uh, you can monitor the patient health and clinical information, getting it from a distance. No longer have to go all the way to the GP clinic or the hospital to get an assessment. Store forward transmissions, so we still have that, either real time or not in real time. And of course, consultations between patient with one or more healthcare provider. Okay. Now, so I keep getting disturbed by messages. The chat is coming in. However, telehealth, as you must understand, is not about delivery technology. This is a misconception we need to do away in order for us to truly utilize telehealth with AI. Okay. Now, why do we even say telehealth is not about technology? Now, the reason why people start to classify it as real time, not real time, is due to limitations in technology, predominantly due to cost. However, as this age of time, technology is what we call now possible. We can do precision medicine for AI-enabled machine learning. It's powered by analytics, uh, data obtained in real time for IoT devices, mobile devices, etc., etc., etc. And if we really need to send them, we can do it literally in real time with 5G, right? What telehealth is really about the delivery of care. It is about bridging the access between patient, consumers, and healthcare professionals, etc. More importantly, it also includes quality, safety, and the human touch. So we're trying to bridge the delivery, and that's important. That's not about the technology. As we mentioned, technology is now possible. It is also affordable. So some of the technologies we have been using these days, which is commonly available, they have been around for the longest time. What has changed is actually the price tag. Of course, more mobility, better battery life, it lasts longer, etc., etc. But technology really has never been the issue. It's a matter of cost, and one other factor which we will discuss later on. And in addition to that, the patients, the consumers are also demanding it. It makes adoption actually a lot easier. So case in point, due to COVID-19, social distancing, people would want to stay away from healthcare facilities. And the other traditional factors that's actually pushing for telehealth, your rural, remote area, etc., aging in place. Okay. And because technology is now possible, we can do something that's very important. Again, this is about the delivery of health. So we can actually move from being reactive to preventive, of course, with the use of behavior psychology. We can actually, so some of the items we have seen, some of the cases we have seen these days is, we're moving from inpatient to virtual visits, we're moving from episodic care to continuous care, we're moving from managing chronic disease, which is you wait for the person to have chronic disease, then you try to manage it. Now we're moving towards remote monitoring, trying to reverse conditions, which is possible for early onsets, and outright preventive care. So this is what I mean by moving from reaction to prevention. You can actually use technology these days to extend the delivery of care, to extend the monitoring to patients, or in this case, consumers, right at their home. Okay, so to move on from that, how do we do that? As we're aware, you can track a lot of this data in real time using IoT devices and obtaining this data, right? And because of the advancements of technology, we almost reduce the need for expensive dedicated medical equipment. So I have a little picture on the top right corner that illustrates an ultrasound machine in a very portable manner. This is unimaginable 10 years ago. Again, ultrasound machine is extremely expensive. You need to go to the hospital, and not every hospital may have the latest. But these days, the device costs are going down, technology advancements are going up. So, you don't really need expensive dedicated equipment anymore in most cases for telehealth. There's also no need to send acquired data to another location. If there is, an app can almost perform the first level of triage. So you run through the data through artificial intelligence in an app, in a dedicated gateway device that you could be holding, reduces the turnaround time. And you don't really need a healthcare professional to process all that data upfront. And I'll explain a little bit more later. Okay. And of course, we're not even talking about the possibility with 5G yet. So when you combine all the technologies together, you can radically transform the way you deliver health and healthcare. Now, as mentioned, telehealth is really about bridging the divide, bridging the delivery of care. But what is important to understand is it is not a one-size-fits-all solution. There are many cases where telehealth is not suitable. Okay, regardless of what solution providers try to tell you, there are cases where it is not, but there are a lot of cases where it is suitable. So how do you really judge? The general rule of thumb is any situation where you have a person visit a health facility only to have a dedicated healthcare professional acquire that data through medical equipment. Chances are you can actually use telehealth and AI. So examples would be stuff like medical images, dermatology. You go all the way to a clinic to have a healthcare professional take a photo. Now you can most probably do that. Or you go there and do a treadmill test to gain your vital signs. You can actually do that as well, of course, with controlled settings, lab tests, observation, counseling, etc. So as mentioned, all this can be augmented with telehealth and AI. So I'm going to give you a very quick case study on how this is one of the pro bono projects I did to illustrate some of the points I have. So for this particular setting, we were trying to repurpose pre-internet era tele-ECG solutions with readily available cheap smartphones. It is China after all, and cloud technology to then modelize these services in the rural aspects of China for the detection of AFib. Now, AFib is a quivering or irregular heartbeat. What is scary about it is that a lot of people have AFib, they live with this condition, and they don't know about it. So even if you do an ECG or do a Holter test, you may not be able to detect it because you actually have to monitor your heart algorithm for extended period of time. So you need monitoring, you need tele-ECG to actually detect it. So let me go into the case study. What happened is we have existing a 1 lead ECG event recorder. This is what it looks like in the picture, and it is prescriptive use. This device is made again, as mentioned, pre-internet era, made in Israel, and they last a long time. Can store up to 6 event memories. So what you do is at prescribed time, the patient actually take this. They're taught how to use it. It's very simple. Place it at the position you see, press a button, and just record the ECG signal. Then they'll go to a public phone, a traditional analog phone, dial a number, they enter their credentials, their PIN, so it identifies them, then put the device onto the phone and press play. So there is pre-internet era tele-ECG, which works pretty well pre-internet times. So the problem is these days, with the advancement of technology, people actually don't have analog phones, not even in rural China. So it makes it a problem. You can't find a transmission medium. And there's also a long waiting time because once you send this in this manner, the diagnosis has to be performed by remote servers. And sometimes due to the fact that this is an analog transmission, the data may be corrupted and needs to be resent. But you don't know that immediately. Maybe 1 day later they'll say, hey, you got to resend the data, so we can do a diagnosis. So it's not the best workflow. It was working well pre-internet times. In modern times, not so. So the solution was very simple. Develop an Android app So it's the same workflow to the end user. They don't have to set up Bluetooth, no fancy settings. Just launch the app, press record, and play on the device. Simple as that. So no change in workflow, very easy adoption. And because the algorithm already exists from the remote server, you port it over to the mobile device. And if the mobile device actually flag out anomaly, then there will be, at the other side of the world, trained ECG tech or cardiologists will actually start to look into your data for a second diagnosis, immediate triage, as opposed to routine checking. And because now the data is collected in such a manner, it can be used for analytics purposes to further, refine the algorithm. So if you think about it, it's actually very simple in such a manner. It's really not about the tech. It's whether how you understand your workflow and use that technology. It's about bridging the delivery of care. And in this case study, we reduced the turnaround first level diagnosis from 6 hours to 3 minutes. No learning curve, very simple, low investment because you don't have to buy new equipment, etc. Phones are cheap. They already have phones. The cloud technology is fantastic, etc., etc. And if you so a quick recap of this case study. Again, as I mentioned, it's not about delivery of technology. It's about delivery of care. It's about bridging the access between patient, consumers, and healthcare professional. And again, technology is now possible. So the next question, so what areas of telehealth use? Now the problem with telehealth is when you talk about, there's a huge range. You can use something as simple as a feature phone, or you can actually use it for telesurgery. So it really depends on the setting. And if you go back to the modern era now, if you come from scratch, you can buy lots of fancy devices. You have your phones, your earrings, and what have you. What I like to show is a smart belt. So you can go on to the extent where it's camouflage, is not hindering your lifestyle, and just collect data, vital signs data remotely. And for other more recent aspects, taking images. So what I really like is the last picture, Novotech. Again, no sales pitch. I don't have any association with them, but they have this technology where they actually take just a photo of you and they come back with a vital signs within a minute. Now this is just using a phone and a picture. You couple that with IoT devices, the artificial intelligence built onto the app in your phone, you can actually change the way how you deliver a lot of your health delivery services. So as we mentioned, telehealth now presents an opportunity to move from reaction to prevention. Technology is actually possible and affordable. Affordable being one of the key elements, and then patients are actually demanding for it. Now, more importantly, there is this sudden trend. It is COVID-19. Now, a lot of people talk about COVID-19 that it advanced the use of telehealth throughout the country, right? But what COVID-19 really did is it illustrate the importance of delivery of care over administrative stuff such as regulatory, reimbursement, turf protection. So you look at Korea is a good example. Telehealth was illegal until recently. And the reason why it was illegal is because the medical association refused to endorse it. And there was nothing wrong with the technology delivery of care. It was just a turf issue, right? So slow uptake of telehealth has never been due to technology or clinical limitation. The technology has always been there. And if you go back to what we said earlier on, with regulatory reimbursement issues because someone has to pay for it and turf protection taken away, now is actually a very good time to further advance the use of telehealth in many, many different aspects of health and healthcare. So with that, I end my presentation. Yep, stop sharing.
All right, thank you so much, Dr. Chee. Really, really appreciate your sharing and very interesting notes over there, especially with how things have been changing and the basically the IoT implementation across even very very old technologies. They are now reinventing themselves to some extent. Oh, well, seems that I've gone off screen, but that doesn't really matter because you're not here for me anyway. More importantly, okay, in between while we're actually fixing this up, let's play the video from our collaborative partners, right? So, but in the meantime, right, ladies and gentlemen, I think that there's also something that I would like to just check in with all of you. Now, I understand that there's a question regarding can we share the recordings after the webinar? Some of you are actually posting questions of where can you get this information? You know, how do we go about doing all of this? Yes. Okay, what we're going to do is that after this entire webinar, we're going to be sending an EDM out with some of the clips and also where you can watch this. But more importantly, like I mentioned before, we're going to be joining, all right? Or it would be great if we can give you the information to join our digital platform where you can actually come back to watch it anytime. We're going to have all this content that's going to be on demand just for you, all right? And the best thing is that registration is not an issue at all, right? So that being said, all right, things are up and running, and let's hear a little bit more from our collaborative partners for this web engagement session, Allied Telesis and Kent Ridge Healthcare. Let's roll it, please.
Every day, organizations rely on wireless networks to deliver services, reach customers, increase efficiency, and grow revenues. People have come to expect Wi-Fi wherever they go, for business, education, and entertainment needs. But people have also come to expect lags in downloads and patchy connections. For today's modern enterprise, that's just not acceptable. Critical applications must have reliable, consistent performance. Period. Don't sacrifice performance for reliability. Ensure uninterrupted, seamless Wi-Fi connections and a higher quality wireless experience. Introducing the world's first no-compromise Wi-Fi from Allied Telesis.